Hi, I'm Dr. Simon Fung. This is an important message for our patients about the coronavirus outbreak in America. The second week of March 2020 saw America turn into a strange and unfamiliar country due to the coronavirus outbreak. It has become necessary to implement changes to protect public health, our patients, and our staff. This video is to explain why these steps have become necessary. Many people, myself included, initially thought of coronavirus as being not much nastier than the flu. It is much worse. To understand this, let's compare coronavirus with last season's influenza outbreak. Last season, about 40 million Americans caught the flu. This was despite 43% of Americans getting the flu vaccine. Coronavirus is more contagious than influenza, and nobody has been vaccinated. Left unchecked, it is not impossible that coronavirus can infect 80 million Americans or more. Besides being more contagious, coronavirus is also more deadly. Estimates for mortality rates from coronavirus usually range from 1% to 5%. If just 2% of the people catching coronavirus were to die, this would mean America would have more than 1.5 million people dying. Your chances of dying from coronavirus doesn't just depend on how dangerous the disease is. It also depends largely on how available medical care is, because survival in severe cases of coronavirus depends on whether we have hospital beds, whether we have adequate nurses and doctors, as well as our equipment and supplies, from protective equipment to ventilators and other specialized equipment. We have all heard that the majority of cases are mild. However, about 20% of patients can suffer severe or even critical disease. These people who have critical disease may not survive if there's not enough medical care for them. How many people will die from coronavirus depends to a large extent on how prepared the country is. How prepared is America? Well, we're not prepared well at all. Until the 10th of March, Americans were being reassured that everything was under control. Over the next 3 days, rapidly we saw the NBA suspended season, the NHL suspended season, and a national emergency being declared. What can we do? The answer is that we must stretch out the outbreak as long as possible. Let's say 80 million Americans are going to come down with coronavirus eventually. You can understand if all of them came down with it in 1 month, it would be devastating and catastrophic for the nation. On the other hand, if we could stretch out these 80 million cases over 6 months, the chances of being able to cope with the disaster is much higher. So we must protect ourselves. We must wash our hands often, and we must protect society by social distancing. We are past the point of containment. As I speak on March the 15th, coronavirus has been reported in every state in the nation except for West Virginia. We can no longer stop the virus because it is already here. The best we can do is to slow down the virus with social distancing. This means do not go to work if you're sick. Avoid crowds. Stay 3 to 6 feet away from others whenever possible. And make sure that everybody you know is aware of what we must do to minimize the impact of this outbreak. In response to the coronavirus outbreak, our clinic will have to make many changes. Please understand that we are not overreacting. We would ask you to cooperate with our staff's instructions, as our procedures are designed to protect both us and you. To minimize crowding, we would ask you to sign in, then wait in your car until we text you when your room is ready. Please do not touch things unnecessarily. This protects everyone. For example, please don't touch door handles and the desks the clinician sits at, etc. These instructions particularly apply to those who have to bring young children. We will always try to accommodate children, but please leave young children at home if at all possible. Please call ahead if you are sick and we will try to reschedule your visit. Ask for a mask only if you are sick. Our supply of masks is very limited. Understand that masks do not protect you from other people. Masks are worn to protect people who are around a sick person who is wearing the mask. Also understand that there are other changes that may be coming in the weeks to follow. Thank you so much for your attention.